We would like to address the topic of increasing SID and OID. SID and OID have to do with the RNF rooms, or your stationary fluoro rooms. And the reason we say that is because you have the tube underneath the table and it stays stationary as far as the distance. It's always the same distance from the table. This is in the normal RNF rooms. What changes is the distance of the II from the table or from the part and from the tube, which means also the object or the patient who's lying there, the distance between the object and the image intensifier also changes. So we're talking about SID and OID when we're talking about the RNF room, but when we're talking about the C-arm, we're talking about the SID is just staying stationary. So the only thing that we're changing is the OID and the SSD. How close is the tube to the patient or to the part, and how far away is the image receptor or the image intensifier away from the patient or the part. So when you're changing SID and OID, what's happening is you're increasing SID, and as you increase the SID, the beam in a spherical manner starts to get bigger. And so it increases the size of the field. What happens then is the radiation intensity also decreases because it takes up more room. And when that happens, you get less brightness from your image intensifier. There aren't enough photons coming into it to give you the level of brightness that you need. So when that happens, the II system will automatically increase the dose to the patient. So as that's increased, dose increases. When that also happens, you will get geometric blur, which means not only are you giving more dose to your patient than you need to, but the only thing with your image is that it's bigger. It's not any better, it's just bigger. So your image is blurrier and your patient's getting more dose. It decreases visual acuity as well as spatial resolution and contrast resolution. So you can see nothing good happens except that maybe it gets bigger. This is just an illustration of what happens with magnification and with dose as you change the SSD and the OID with a C-arm. So we're starting with an SID, a fixed SID of 100 centimeters with 80 centimeters SSD and 20 centimeters OID. And they're using arbitrary numbers here. So we're going to say that we have a source exposure to the skin of 1.0 in dose units. And the magnification is minimal at 1.25 because 1 is no magnification. But when you increase the OID and you decrease the SSD, so you change the OID to now 40, it's doubled, and you decrease the SSD to 60, what happens then is your dose increases to 1.8 dose units and you get a magnification of 1.67. The very last image, what you're going to see is an OID of 60 with an SSD of 40. And now you're going to see 4 times as much dose as when it was at an OID of 20. And the magnification is now at 2.5. So you've gone from basically no magnification to 2.5 magnification factor. And you've increased your dose by a factor of 4.